YouTube comments from a video titled, Medical System is About to Collapse. How to Save Yourself. Part 2.
Jill Anderson 401 wrote,
I want all three of you to know how grateful I am that you are talking about this publicly. I worked in healthcare OT and then medical coder, and I have been disabled with severe and chronic health conditions for over 21 years. I just spoke yesterday with an Epic representative and told him of problems with Epic and that since started online charts, healthcare has been in a rapid decline and has made patients' lives worse. I have many autoimmune diseases and am lightheaded/dizzy every day, between 50 to 80% of my day. I am told it is all because of autonomic neuropathy. I feel my doctors are so computer fatigued that it is difficult for them to be able to find energy to problem solve or think outside the box. Patients like me who don't fit textbook signs and symptoms. Thank you for giving me validation in how I have felt about healthcare and what I have been witnessing in the past 10 to 15 years. God bless you all for your courage and bravery, and I hope you continue to bring healthcare concerns to light.
Wally Evans 4228 wrote,
At 70, we have zero meds, have no family/special docs, no aches, no pains. We have really good health and run 20 miles weekly. Changed our diets 13 years ago. WFPB lifestyle.
Manuel Mutinho 6845 wrote,
The upcoming economic/monetary collapse will fix this, along with all other distorted systems of our society caused by our corrupt, fiat, monetary, debt-based Ponzi scheme. When sound money returns after much worldwide destruction, we will once again rise from the ashes and flourish in all aspects of society, including medical, pharmaceutical, legal, educational, religion, and all others. What will stop this resurgence would be the adoption of a central banking digital currency or other fiat replacement of our currency. Make fiat money obsolete again. G ready to pay for your own healthcare directly and without any third-party participants.
Nori C1Q wrote,
I love listening to you three. You speak the truth. I do think our medical system is collapsing here in Canada as well. I'm a retired RN, and I'm so glad to be out of the medical system right now. I'm very hopeful that once it collapses, it will build up better.
Fetrem wrote,
I originally gave this video a thumbs up until I realized the three of you are simply shilling for AI after discussing, as though you really cared, the systemic and devastating breakdown and annihilation of patient healthcare. A most cleverly devised and orchestrated conspiracy to eliminate doctors and replace them with AI. Incredible. So disappointing. Good luck in growing yourselves a conscience. Or is it simply common sense/logic you are in need of? Nope. I think I hedge for shilling.
Morecat wrote,
I feel like I owe it to my doctors here in southern Idaho to speak up about the excellent medical care I receive here insured by Medicare and CHAMPFA. Perhaps we have lost the middle ground. I don't doubt that this is not the experience of a lot of people, and I fear for those who are uninsured. So I wholeheartedly believe that we need major reforms, but mustn't lose sight of the many outstanding doctors, nurses, and medical staff who faithfully serve their patients.
The Banks H8P wrote,
Thank you, my three musketeers. I have learned so much from your videos. Again, thank you. I do have a question. Where would I begin my research for real research/studies downsides of statins, especially in the elderly?
Driving Meskina wrote,
Thank you for shedding light on this issue from your perspective. A lot of people think doctors and medical staff is to blame. I have a friend that got a medication that costs $7,000 per month free for a year. He thinks that the manufacturer decided to grant him the honor, not knowing that it was likely his doctor that fought tooth and nail to get it for him. That year is coming to an end in a month or so. I don't know how it's going to go for my friend. But more doctors really need to speak up about this issue.
Fetrem wrote.
I wonder exactly how many doctors have ended their lives as a result of this ridiculous situation, especially over the last 5 years, where so many were effectively forced to enforce certain mandates in order to keep their licenses and discovered, to their horror, what it is they had participated in doing. I am aware the stats for doctors unaliving themselves was high before COVID, but my guess is that it must be absolutely through the roof now. I wonder how we might obtain accurate stats on this?
At Marie Bentz 4702 wrote.
Totally agree. There's billions available for wars, though there isn't any for the people's care. The corrupt leaders are the problem. American taxpayers have paid billions to Israel for their Gaza killing machine. It's disgusting.
A Farmer Girl 7 wrote.
I just had the unlucky experience of 3 major procedures. It involved 2 separate hospitals. The hospital staffs were great, as were the doctors. I walked out of both places strong and healthy. The hospital food was actually good. You had a choice at every meal. In fact, you had a lot of choices, from the main meal, fish, meatloaf, etc., to 4 different kinds of vegetables, and the choices went on to drink and dessert or fruit. The same for breakfast and the evening meal. Oatmeal, yogurt, pancakes. Sandwiches, all kinds, soup homemade. Even freshly baked rolls. I got fantastic care in clean, well-maintained facilities. These hospitals are not in a rich area. One is a local hospital with a great chef/cook. The doctors and nurses explained what they were going to do. I bet there are great hospitals all across the country, just like the ones I went to.
At Salive 3263 wrote.
I forgot to add that with all of the money-making schemes and with trying to put seniors on medications so the system can make money, we are petrified to go to a doctor or hospital for any reason unless it's critical.
At Salive 3263 wrote.
I'm a 62-year-old woman. My BP is not high enough to go on BP medication, I am told by my GP and my cardiologist. A few years back, I had open heart surgery for a bicuspid aortic valve. No heart disease, diabetes, or anything else that I know of. I try to eat healthy. My AIC was 4PONT6, and since everything now is so expensive, and especially medical care, my husband and I stay away from doctors and hospitals unless it is dire. This is what it has come to. We don't even go for a yearly checkup unless we have symptoms of something.
At Tonid 7996 wrote.
Dear Dan Dio, you think this has gotten much worse since 2021 by 2022/2023, or what's your thoughts for the overload like here in UC? Or is it a lot of things like immigration and human replication expansion? Or others?
At Normastar 4390 wrote.
A few weeks ago, I was at a new patient appointment, and right in the middle of me talking to the NP, she jumped up, stuck her hand out, and said, "It was nice meeting you. They will help you at the front with tests. Have a great day." And she left the room. I thought I did something wrong. I guess my time was up. It's really ridiculous.
At Joan Brown 2842 wrote.
The lack of easy access to healthcare may turn out to be the solution to the metabolic disease crisis. Once people realize that they must be mostly responsible for their own health and stop buying junk food, this will cause the food manufacturers to change or go out of business.
At Marie Garcia 3560 wrote.
It wasn't doctors' fault. It was Obamacare, and that sent private doctor offices into retirement, into hospitals, into bankruptcy because their patients were forced to take state insurance to avoid the penalty that was imposed upon them. Lots of doctors were defunded by regulations for themselves and their patients.
At WebSurfer 5772 wrote.
I have 2 wonderful new doctors. Rheumatologist, Dr. MD in Walnut Creek, CANPCP,
Dr. Natasha Kokarod in San Francisco. CA, thank you for this informative video. I really appreciate the three of you for caring enough to tell us what's happening and what you see in the future for doctors and medical care.
At Tracy Sanchez, 3399 wrote,
Medical care is in trouble, but you guys are also part of the problem as well. People have been groomed since the 70s that there is a cure for everything when reality chronic illness is not curable. It is manageable. People die. Chronic illness exists. Providers try to help based on current dogma. Patients feel better with many of our therapies. Cost and access are horrible barriers. Doctors and providers are exhausted.
at BEP Repaired, 7391 wrote,
Another recent issue was I thought it was strange how my doctor's summary of my APOP was almost word for word verbatim everything I said. Good thing I checked because they made errors. They admitted using AI to listen during the apt and write the summary. They did not review what AI wrote, and AI misheard part of the discussion, and the result was medical errors in treatment recommended. Please tell your family to always review their online account.
At Meadow 8787 wrote,
It's such a scam system, all the comments here prove it. We are so sick of this evil-ruled country. We just need someone to lead the revolution. Let's stand together.
At Julisil 4525 wrote,
Now, you can only talk about what the app is scheduled for. If you have another problem, you have to make another app. The whole system is about money. I believe we will have a new system. Current system and Obamacare is unsustainable, thankfully.
At Jessica Lynham 7356 wrote,
My husband was so disillusioned with the system. He walked away from medicine. He went to a college to help start a PA program. He discovered direct pay practices. He started a practice where he took no insurance. A number of the patients still had insurance that they could use if they were ever hospitalized or an X-ray and other tests he did not provide. His patients paid $50 a month in the beginning. After 5 years, he increased the payment to $60 a month. Most of the time, people could get same-day appointments or at least the next day. He had time to spend with his patients. Because of that, he could treat the entire person instead of just their current ailment. He also got his certificate to be able to work the machinery at the local gym. And patients would meet him there, and he would walk them through the equipment. He loved what he did. He has since sold the business, and it is still thriving. The insurance companies nor our hospital machine is not in charge.
At AGNN 8LP wrote,
It has already collapsed. I was dying in debilitating pain and left for dead for 10 months. I ended up having Lyme and Bartonella and anaplasmosis. No DR will even acknowledge these infections. Now I'm left in chronic debilitating crippling bone and nerve pain and dysautonomia symptoms. No one cares.
At Sassy Sue 777 wrote,
RN for 30 years and just left the field. Last job in the ED. No job. No plan. Just got the heck out. I couldn't do it anymore. It felt wrong to have any part in perpetuating the lie. And just keeping quiet to make a paycheck also felt terribly wrong. The stress and anxiety, the control by insurance, management, and private equity involvement making humans into cattle was too glaring. Heart monitors and beds from the 70s, but robots blocking the hallway to deliver pills from the pharmacy, with the cost for them being enough to employ 5 or 6 techs, was too much. You could get the nurses on here in the comments to make one really long list of the issues. From how docs and managers are trained, to drugs and big pharmaceutical, allowed labs, to social societal meltdown. It's a total train wreck.
At Demedex 42 wrote,
Healthcare is a scam. I went to my yearly wellness exam. It's covered 100% with my insurance, but since I asked for a referral, I have to pay $145. Now I don't ever want to deal with them again. They basically lost business because I'm not going to the referral I asked for.
A Holland Gem 2 wrote,
I go outside the system for everything except I'm still on a little bit of Xanax, which I can't seem to get off of, and nobody is willing to help me do it in a way that is healthy for me. I cut down the fourth of a milligram and had all kinds of neurological issues, let alone tons of other physical symptoms that I was very ill. That was a couple years ago. I never raised it again, but I'm still want 2 milligrams, but I have had severe panic attacks and central nervous system issues since I've been very young and now 72. They tried me on all kinds of antidepressants, which I could not take. I seem to have bad reactions to all of them. Tried that for a few years many years ago, will not go back. Became a holistic health practitioner, and I work with a naturopath, and then nurse practitioner, and also functional medicine DR, as well as acupuncture, energy work. All my friends are on like 6 or 7 different drugs, plus they get all the vaccines, and they're sicker than hell. I don't even bring up anything about the medical system with them, because they all believe everything. The doctor says especially fond of their pharmaceuticals, and they have no idea that some of the pharmaceuticals are actually causing some of that really bad side effects that they're having. They just keep going back to the doctor being put on other medication to take away side effects of the other medication. I know nothing, and at this point I don't care what the hell they do. I worked for a naturopath for 7 years, so I did learn a few things. And I studied this holistic medicine compared to allopathic medicine, which they all believe is the real medicine. And again, in an emergency situation, everything has its right time, right place. But they get people hooked on these drugs like their Xanax and many others. Some people think steroids it's just another way to feel good, and as for injections all the time. My body cannot handle steroids, unless it would be an emergency situation at very low dosages. We definitely have a care system. No one wants to look at lifestyle changes. People have to wake up and realize then unless you're in an accident you do have control, and the body can't heal itself. But they get you hooked on drugs, and the more you go, the more they want to give you. Have I taken all the drugs that they wanted to give me over the years? Well, let's just say I probably wouldn't be here.
Paula Galloway 528 wrote,
DRs won't treat pain anymore. I'm tired of living in pain. It takes up to 3 weeks for CT scans to be read in my area. AI could help with that. Tired of some arbitrary decision being what directs care, BP limits, cholesterol limits, etc. Need to utilize AONPs in basic care more. I see more PAs than doctors.
Tamla Lalland 3777 wrote,
It's time to eliminate the third party that overrides the doctors and says their opinion is better. Insurance companies are difficult to deal with. It's been a constant problem. Pay more, receive less service.
Garrick 1122 wrote,
Yeah, when it was mentioned about looking at a new patient and how the cues of what type of pet do you have, it reminded me of an assistant asking me cues. And one of the questions was, do I own a gun? What the?
Jeff Watson 151 wrote,
I went to the hospital recently for an infection on my ankle. A lady DR came in early one morning and told me that my DR said he wanted them to do an angioplasty with stents on my left lower extremity, not knowing that I just saw my DR. I told her I advise you to get whatever DR told you that to get to my room ASAP. She stormed out the room, and 2 other people came in asking questions, trying to make it seem like I was delusional. I am very informed and told all of them that if the DR that requested a leg angioplasty with stents to get to my room ASAP. And for all of them to get the hell out of my room.
Linda Collins 8703 wrote,
I don't answer data questions. Tired of them thinking they are my babysitter. I don't need to tell doctor if I have a seatbelt on while driving. And I won't go on scale unless I need specific meds that weight matters, like anesthesia. I don't trust the medical system. They ignored my symptoms. Had a pheochromocytoma and sick for years, even was seeing a nephrologist who didn't even check my kidney. It was a nightmare. Finally found it accidentally. It was God that allowed it to be found, not the crazy medical system.
Epicag 1793 wrote,
You can add density to this list. Lies and lack of knowledge of newer, less invasive methods for treatment. Fluoride is one of the biggest scams ever. I practiced for 25 years and finally quit as my soul couldn't take the weight of terrible standards. I refused to recommend fluoride treatments and needless deep cleanings that the sellout corporate owners wanted pushed. I never once heard a dentist discuss the impact of carb-heavy diet on dental health. They only want to drill and fill or remove and replace.
Adoxameister wrote,
In my little town, we have a tiny regional hospital, and up until the last 15 years, we had 3 private practice doctors, plus a small outpatient clinic attached to the hospital. We have a doctor who is nearly 100 years old who still practices out of a little office on Main Street. My boys are in their mid-40s now, and this doctor sewed up my son's foot when my son was 15. The doctor was gray-headed even then. He still pulls a rotation at the hospital's ER once a week. I'm not sure, but he might be the oldest practicing doctor in my state. My own personal family doctor was trained by him, and my doctor retired when Obamacare was put into place. He told me in advance that his practice could not afford the fancy computer systems required by Obamacare. They even would have been required to hire an IT team to digitize all the patient records, get the system up and running, then train the staff to use it. At least he gave me advance warning that I would have to find another physician. Things have gotten so sad.
Edgotsarmy 337 wrote,
Keeps me on pregabalin. It doesn't help the problem, it masks it. Then I can't use my leg. He's gonna have me in a wheelchair. And then I switch to Revive and he says no.
Edgotsarmy 337 wrote,
Oh, my doctor says no to rebuilding knees or anything before surgery. I know surgery can be a trial in itself, and he doesn't believe that I can do some other things before surgery lasts.
At Michelle Walters 4484 wrote,
Our administration needs to focus on getting corporations and public equity firms out of our healthcare system. It's not meant to be a for-profit business. The healthcare system should be taking care of people. Doctors just want to do their jobs, and these businesses hinder their abilities to do so.
Edgotsarmy 337 wrote,
DR spends minutes and proceeds to roll out all the medications with asking what happened. Then they say, I need more help with you because I only have a few minutes. Let go over her to the mental health building and they can get more meds for you, cheese and crackers. I love you.
Edgotsarmy 337 wrote,
I do more holistic now and sound chakras for my therapy. I even try to not take the meds from doctors. However, they say I am knowledge deficit now. I don't feel so bad.
At CR 8833 wrote,
I'd love to check insurance and just self-pay. There were a few years I did it, and it was so freeing. However, I'm having all sorts of autoimmune symptoms. I'm nearly 50, which have been off and on for decades, but are definitely worsening. I pay attention to foods, exercise, Etsy, and try hard to keep some semblance of decent well-being going, but I feel like I'm losing. What's someone like me supposed to do when these issues are falling outside the scope of the PCP? Specialists are required, and we have to go through years of trial and error with tests and meds to figure out anything? I don't know what direction to take or how to better help myself.
At Genevieve Guerra 6162 wrote,
I was an RN working in the hospital on a medical/surgical/telemetry unit. I stayed at the bedside for 37 years because I loved being a nurse. The change from the 1980s has been a constant decline in care. When I started, We had 3 shifts, so fresh eyes, fresh minds, and bodies were coming in to give care. Now, we worked 12-hour shifts or longer when staffing is short. I know I am most likely to make an omission and forget a task. It's towards the end of my shift. We spent 75% of our time at the bedside doing wound care, teaching, answering the call bell, giving comfort measures, making sure patients were turned, walking them, reinforcing rehab exercises, and teaching family members. I spent about 25% on documentation. Now nurses spend way over 50% of our time documenting. Documenting to make it easy for billing, for oversight agencies, and for lawyers. So for a 12-hour shift, take away time for lunch and breaks. So now you have 11 hours. If 50% is spent on documentation, that leaves 5 hours for actual patient care. If you have 5 patients on Lucky California's ratios, I'm only allowed 5 patients. That leaves about 1 hour each for my patients of actual bedside care. That's why I would come home and cry after my shift. That is the moral injury to the nurse. You could not give the care you were trained to give the patient. You couldn't turn the patient often enough. The patient that waited for pain medicine, the patient you couldn't walk, and hope your colleagues on the next shift can walk them.
At Mickmanemy 7701 wrote,
Adopting a healthy lifestyle to prevent chronic health problems is a good idea, but there is huge confusion and controversy about exactly what a healthy lifestyle is. Most doctors readily admit they know nothing about diet and exercise, so finding a trusted and qualified guide is crucial. AI or Google simply finds national guidelines which have been wrong for decades.
Steiner Nicholas wrote,
As a doctor, I thought I understood the human body until I read Healing Beyond the System book by David Collins. It uncovered the missing links between medicine and real healing that medical school never covered.
At Beth Israel, this is REA 5270 wrote,
A word from the Lord. I en teach e future man will no longer goto doctors or hospital for fear of losing their lives. WEREINTHE last days. Agenda 2030 depopulation through wars, famines, shots, and plagues.
Stephanie Collins, Zoo 9 UK wrote,
My homeopath has done amazing things for me, which include cure. I think I lost my GP since I don't go for all the preventative tests. I will always be grateful for paramedics and ER doctors.
At MNB8 wrote,
Clearly, they want patients to stay sick. They don't make dollar if not. Clearly, this is proof we have to get a nationalized healthcare system where their fiduciary is to save dollar and keep people well.
At Lycée 3995 wrote,
Fear of the Lord is the beginning of wisdom. The Bible speaks to everything we face today. All crimes against humanity is because of the love of money. The Bible tells us the love of money is the root of all evil.
Ken Albright G9M wrote,
If people would get off the what if syndrome that the healthcare system has created with preventive care, get back to taking care of themselves, with eating a healthy diet and going to the doctor only when they're sick. People take too many unnecessary medications when they lack of the right foods, with the right amounts of vitamins and minerals in them, will go a lot farther in preventing and aid in combating sickness in their lives.
At God's Army 337 wrote,
Biden ruined our nation, kind sirs. Too many immigrants are in New Mexico, totally living everywhere in tents, taking our food stamps, social security, and health care. We need help in Albuquerque, New Mexico, because it's a blue state, and it's horrific.
At Vanessa Swerter wrote,
Please be very careful with the animal vets you choose, because they are all being bought out by greedy corporations. Ask questions, don't be intimidated because they are pushing way too many vaccinations. Never give more than one at a time, and only the bare minimum. Poor training and lack of breed understanding is going to get worse as the older experienced vets who were able to think out of the box are retiring.
At Roared 4852 wrote,
In 1997, the AMA supported a federal law that limits the number of doctors that are trained each year. The AMA now opposes the law, but nothing has been done to repeal it.
Ekatiejo 711 wrote,
Can someone tell me why the insurance companies keep calling me to go get all my tests? They send me a color guard in the mail. They want to give me money if I get my tests. They keep calling me and asking if I need any advice. Are they getting a kickback from every test? I personally don't want anything to do with them.
Vidalung 169 wrote,
If any group of wealthy people should be able to construct an alternative to what's being feigned as the healthcare industry, it would be the doctors. Where are you all?
At Lynn S.J. wrote,
The delivery system is broke and broken. I heard it takes $1 million a day to keep doors open. Medicine is human connection. As someone actively in a piece of the system, I personally cannot move myself to CMDs in my same system as a patient. Tried many times, it turns my stomach. There is important work being done, difference makers driving the system. Usually it's on the side or outside the system we see. Research, invention. Doctors have to draw the personal boundary line in many ways. If they don't, the patient system will overtake. As pharmaceuticals, most are synthetic chemicals to mask symptoms. They have other effects or stripping of other essential vitamins that have to be supplemental. They serve their purpose for those asking. You have to be your own advocate and know the difference. HC will keep chugging along until one day doors close, staff laid off. Happened many times, and there are still abandoned hospitals, centers that cannot be reopened. It's a gamble. Bills, overhead, insurance rules, all top execs are business people. At the board's choosing.
At Helga Filet 4352 wrote,
So very true. I went to the ER when I became sick with shingles. I was referred to a doctor whom I never got to see. Instead, I got to see a so-called nurse assistant. I am sure she meant well, but she never went through medical school. My cholesterol was a little high and she wanted to prescribe statins. I don't trust drug salesmen. I decided to treat myself instead, looked up what to eat and what not to eat to bring my cholesterol down.
At Spicenson 7725 wrote,
I'm newly retired on Medicare. I am bombarded almost daily by my insurance company calls. Unbelievably irritating. Reminders for every fricking test available in the world. Since I've blocked any hash they call from, they go directly into my voicemail. So I continue to block and will change companies. But I'm sure they're all the same.
Chattanooga Dave wrote,
100% correct. Patient records are a joke. My parents are furious and they have the best health insurance because of my dad's military service. Rural America is even worse. I'm in Tennessee and it's a joke, to be honest. As they call it, God's waiting room. Copays are out of control too. Forget approvals. So many denials too. Profits over people.
Katrina 82 wrote,
Must be nice to have the money to afford private health care. I'm disabled. I can't afford that even if I was healthy, let alone the medical care I need. I'm dependent on Medicare, and yeah, their policies have left me more disabled than I should be. I'm currently on a 4-month wait for initial with GI for severe symptoms. Also, I absolutely agree that diet, nutritional supplementation when needed, and healthy movement should be core to everyone's self-care, but people need personal time for that. So many kids are eating convenience foods because their parents are too burned out from being working parents, or were raised by burned out working parents and don't know any better. And it's easier to throw a TV dinner in the microwave than to cook a healthy meal, no matter how easy. If we really want a healthier society, We need to get employers involved, making sure people have proper compensation and personal time so they have the time and energy to properly take care of themselves. And we need to put home ec back in schools and make gym class more about exercise than gameplay. Kids need to be taught proper health. I sure wasn't, neither from parents nor public schools.
A Catland 1566 wrote.
It needs to collapse. I'm 74, retired RN. Stopped all meds prescribed 10 years ago and am healthier today than I was then. I hate that I was a part of the medical regime.
At Lori 9182 wrote.
I believe the education or lack thereof doctors and nurses receive now is a huge part of the problem. They are teaching them to be part of a machine, not discerning thinkers. Everything is a protocol with numerous tests that take months and a pharmaceutical endpoint. I've been an RN for 41 years. I resigned/retired in 2020 due to the disgusting treatment of patients and their families. I saw the decline happen over a 20-year period.
As Sandra Bigaka wrote.
Well, of course it will be bad as it can be for some. But I would bet many will feel a lot better when they finally can't go to a doctor. No more poisoning. Also, having the obvious reality finally smack them in the forehead that no one is coming to save you.
Dana Smith 1922 wrote.
Gold Care is available online and puts you in touch with doctors that have opted out of the system all across the USA. Simone Gold, a doctor in Florida, created this after the whole debacle in 2020.
At Champagne Shore 5256 wrote.
What a timely video I am watching. A couple of days ago, I went to my new doctor for a physical. I had not been to the doctor in probably 8 years. My physical consisted of the medical assistant checking off a form on her laptop. The questions were things like, do you smoke? How many glasses of alcohol do you drink a day? Do you wear your seatbelt? Do you exercise? That was the extent of my physical. I was shocked. I still feel shocked and highly disappointed. Since I hadn't gone to the doctor in so many years, I thought maybe I should just to make sure everything is okay with me. What a disappointment.
Dana Smith 1922 wrote.
I am a nurse of 40 years, and what we see now as healthcare is really sick care to keep feeding the machine. Many of these older doctors are frustrated by EMRs and meeting the conglomerate's number requirements. Big pharma and insurance companies are all owned and run by the same people. The best thing anyone can do for themselves is get as healthy as you can and step out of the matrix. No one teaches patients how to get healthy, it's all about giving them another pill.
Critbon Mom wrote.
I'm very curious what medicine is like in other countries, and can we model our system after anything better? My family in Asia, Taiwan, and China say that things are so efficient there. You can get an exam and CT scan in less than 45 minutes on the same day without an appointment. Obviously, the government system in China is completely different, but can we look to any others?
A Common Sensibility wrote.
A woman at our cardiology office tested positive for meth, but got to keep her job of 1 year. I had to resign from my job there after 22 years because I wouldn't take the vaccine. How was I seen as a danger to patients, but she wasn't? I'll never work in a medical facility again.
At Georgia 75231 wrote.
Doctors haven't been practicing medicine for years. They are cooks following the big pharma/insurance cookbook. Why did this happen? Look in the mirror, doctors. You let it happen. You took the drug company trips to Bahamas. You had to have the big house and fancy car. You got greedy, and the arrogance is off the chart. Nurses are included here. I got MRSA in a hospital, only to be told it was my fault. Wow. Nurses are nasty, doctors are nasty. They don't wash their hands. They go from patient to patient with nasty hands. Lazy, neglectful, criminally negligent.
At Wonky Woman Life wrote,
Electronic records have several mistakes too. Get yourselves well, stop taking pills for everything, except if you absolutely have to. They used to write out their notes on paper during your act.
At Wonky Woman Life wrote,
My lung DR told me it was collapsing months ago. There are medical people who really do not know what they are doing. Heck, you do not see your DR. If you are sick, you are sent to her.
At Ad6417 wrote,
My biggest frustration when I actually do seek healthcare is the inability to get past all the gatekeepers and actually get time with the physician. We are given appointments with PAs, CNAs, nurse practitioners, but it's almost impossible to get with the actual doctor. I shouldn't have to pay the same rate for a nurse as I do a physician.
Ashradanich wrote,
I retired from hospital administration last year. I could not watch a hospital become more and more unethical. Doctors have no say in what happens unless the insurance companies agree. It's a dangerous time to be a patient for sure.
At Ramuan7518 wrote,
When I saw the video of that lady telling doctors they were going to trans kids because it's a long-term moneymaker, I knew they were profit over patients. Actually, I knew it in 2020 when I saw everything that happened.
At Erica Smith 7871 wrote,
The system isn't failing. It is functioning as designed. We just don't want to admit that the design is to maximize profits and has literally nothing to do with maximizing health. Definition: if system heals us, that is not profitable. A sick patient, a chronically sick patient, is a great asset to this medical business model. Once you see that fact, you are no longer confused as to why things are set up the way they are, and it's easier to remove yourself from the death grip of allopathic medicine. I originally wanted to be an MD, but thankfully, it was introduced to naturopathic medicine and switched to tracks. So thankful that I do. The reality is, if people embrace the healing power of nature, they don't need medicine. Foundations of health are food, water, rest, community, connection with spirit, just the basics. With the exception of acute injury, there is no reason to see an MD. I am 48 years old and have not seen an MD in 20 years. The best way to remain healthy is to avoid the system, as its job is to feed itself, and you are the food. The body is a self-healing organism when given the right conditions, none of which are found in an MD's office. People are waking up to this and taking control of their own health, which is a beautiful thing.
At Lauraval Pentester wrote,
I wish my father was still alive so I could share this channel with him. He wrote thousands of letters over decades to newspapers, medical journals, New York Times, etc. I have copies of all of them. Dear E.J. Volpintesta.
At Lauraval Pentester wrote,
I stopped going to OB after going for a routine exam 15 years ago and catching a bacterial vaginal infection, a TTHE visit. Idiots. I told my stepmom, who was a nurse, and she said you'd be surprised how often that happens. Last time I went to primary care for a tick bite, he wrote massive depressive episode on my chart because I told him my father had died, and I think he wrote that just so he could push antidepressants on me, because expressing grief is just a normal thing. I wasn't asking for help, I was just sharing in conversation. What an ass. I do rever these doctors because I grew up with a doctor dad. I know they are humans. My dad was primary care and detested the system.
At Lauraval Pentester wrote,
My father was a community doctor who make house calls. I remember his doctor bag, and sometimes he would bring us kids on a house call, or to visit the elderly. I think he felt bringing the kids brought joy to them.
At user MLK D9 you wrote,
BTW, those Medicare wellness exams cost around $900 per patient. The insurance companies or the clinic gets paid. It's a moneymaker that our taxes pay for. By refusing, which is your right, Noon gets paid. One day I was 69. No one put me through this test. I turned 70 and there is constant pressure to do this. Why OUCA and refuse? Why you don't have to do this test?
A Trek for Truth 2841 wrote,
Once I came to the conclusion 18 months ago that germ theory is completely wrong. It became clear allopathic medicine was doing harm all day, every day, with few exceptions, such as emergency and orthopedic medicine.
At Artists Meet Film 6491 wrote,
You are punishing your sick patients through very nasty admins who refuse very sick patients. It's becoming inhumane, and it's fully disgusting. You're talking about us in nasty ways. WE here, YOU. Doctors are very much intentionally refusing care in misassumptions of who you think we are. We are very frustrated. You are leaving us unable to breathe, then you lie about the damage it's doing. You also are not allowing us antibiotics we need, so we're getting seriously ill. I've been told multiple times doctors are in charge here, that there are certain doctors who can change what patients get and don't get. I also know you intentionally do not hook us up to vitals, then lie about fake information. I've had ER say my blood is normal when NO blood was even drawn just to get rid of a complex patient. I also was blocked for several years out of my own records after being told my results were all normal only 2 years after they all denied me appointments for those NOT normal test results I never knew about. This is destroying my ability to get better as you took everything from me. I think you want to act like you care because I've heard your disgusting conversations. This is 100s of you, so I'd like to know which ones of you really care, because that caring from my experience is absolutely gone. I also get toyed with hope of things that are dangled at me all the time, and then none of it happens like you enjoy tricking your sick patients. We used to highly respect our doctors and medical people, but you have become so evil. How long do you want us to believe you when you are literally jabbing us in the face with your bizarre behavior every time we need your help? Grow up, and if you want things back, get your acts together, and we will back you again.
At user MLK D9 you wrote,
I'm 73 years old, and I thank God every day that I'm on only ONE medication. My doctors want me on many, but with the grace of God, I'm still alive without them, for now.
At Arla Tejimays 5776 wrote,
Thank YOU for keeping us informed. Recently, my insurer, UHC, dropped the #1 Trauma Center, the #1 Cardiac Care Hospital, and the #1 Specialized Medical Group in my area. This severely limits my choices and leaves me with substandard care. Insane.
At Deniseg Hill 1730 wrote,
I'm so glad I live in a European country. It's not perfect, but I don't have to worry about finding money to pay for RIP off prices for medical treatment.
Efranian 4215 wrote,
Thank you for this video. You've touched on many gripes I've had about how healthcare has gone down the tubes since I worked in healthcare. I blame insurance and big pharma greed. I do not want the history I've had with my doc and his treatment plan being overruled by a person at the insurance company who has never met me. And during COVID, my eyes were really opened when docs had to follow admin's protocols or be fired instead of just prescribing ivermectin. WTH? I'm now on Medicare and get to draw a clerk every year as part of my wellness exam. If the doc could spend a few minutes talking to me, I think that would clue him in on any signs of dementia instead. But while I'm adding the hands on the clock, He's working on his tablet, not even making eye contact with me. Then comes the knock on the door, so he gets up, puts his stethoscope on my back for literally 1 second as he passes me to get to the door. Then he tells me to come back in 3 months. And when I come back, he asks why I'm there. Because you told me to come back. I'm sure they're trying to beat the system and get more office visits paid for. It's a 2 to 3 month wait to get an app if I'm sick, so I'm supposed to take my Medicare card to urgent care or ER. So my primary isn't anything more than a triage person, directing me to this specialist and that specialist. If I didn't need a prescription for thyroid meds, I wouldn't play the game anymore. I wish I could find an independent doc who took Medicare. These corporate guys are burned out and need confirmation through technology before they treat me. They have no instinct from experience anymore. I want a doc who will get to the root of my problem instead of band-aiding me with a prescription. But Big Pharma convinces them that their latest pill is the answer, and they don't have the time or energy to research to know otherwise. I have a heck of a time finding a doctor who doesn't practice 1965 medicine on my thyroid. I'm so done. Disgusted. My trust is gone. My friend just got out of the hospital where she was told she'd be dead in 3 years. Went for a checkup with a specialist today who told her she'd had viral pneumonia that was gone now, and from the hospital notes, he couldn't understand what made them conclude that her lungs were failing. Trust doctors? Why? I'd write to Congress so they could check on Medicare practices. But they seem to be getting wealthy off insurance and big pharma payoffs, so I agree with you that medicine will continue to get worse. The power lies with the greedy, not with our doctors.
At Jeffrey Dennison, 9029 wrote,
There's a serious problem with relying on AI or suggesting to patients that they rely on it when researching general well-being suggestions. Namely, what datasets are the models trained on? Does the AI rely on Wikipedia and pharmaceutical industry claims? Ask your particular AI model about Linus Pauling or Abram Hoffer or Nicholas Gonzalez or even Joseph Mercola. How about, are COVID vaccines safe? Is glyphosate safe? Picking some random AI to give health advice is not a whole lot better than doing the same on Google. Billions of dollars are spent on PR persuading the public to eat foods that kill them and make them dependent on pharmaceuticals. Do you actually believe AI models available to the general public would not have the same financial influence behind them? Which do you think is actually easier and cheaper in the long run for public persuasion PR or AI?
At Marinod 6732 wrote,
Another truth. I worked in insurance as a career insurance broker for the property casualty side, not health or life. And the only thing you need to know is this. Insurance from an underwriter's perspective is a financial business. It is all about the cash flow and float. Interest generated by cash reserves held for future losses, minimizing underwriting losses and maximizing profits. It is not about the health business, or burned or windstorm damaged buildings, or liability due to accidents or negligence. It is strictly about generating enormous flows of cash, which by law must for reserves be invested very conservatively to earn interest, holding on to the reserves as long as possible, all while increasing premiums every year consistently, reducing staff as technology improves, and holding servicing costs down. The risks assumed in the insurance contracts are there to generate ever-increasing cash flows in a permanent cycle of renewal. For large corporate clients, insurance is merely a mechanism for leveling out large losses to avoid negative impacts and quarterly earnings that could impact stock prices of the corporation, called risk financing. Underwriting and paying losses is just the mechanism to get access to billions of dollars, which generates endless streams of cash. Once this became clear to me, I laughingly asked my big boss, "How is this legal? Isn't it really a fabulous self-regenerating business model?" Would you let your banker make decisions on which medical treatment or prescriptions are needed for a condition? No. So why does the medical profession let the insurance financiers make the medical decisions? Or decide how you should interact with your patient? Or how long they can stay in a hospital? Food for thought.
At the Happy Sheep 2023 wrote,
Oh, not to mention the corporate and computer systems at sea. Errors galore. Just like you doctors explain the paperwork and the documents are unreal, and when you do find pertinent health and treatment information, many times it is absent, flat out totally wrong or not complete, and full of errors. I had to fight my husband being transferred from the hospital to his new nursing home, and all that paperwork was a nightmare and the medication orders were wrong. Head nurse of nursing home tried to gaslight me by saying, oh, we medical and hospitals don't make errors. I let her know right quick just how big of a lie that is. She doubled down on everything as you might imagine. I went round and round, but I did finally get the meds corrected. I had to rattle a lot of cages several times and had to end up in a full-out, irate, loud voice, and talking crazy to render any effective corrections. Now that in itself is sad. I started out kind, then professional, then going up the proper chain of command that culminated into my having to go full-out do crazy in speech and attitude. Totally awful. If that had not worked, the next move would have been a lawyer.
At the Happy Sheep 2023 wrote,
Is it still possible to have a doctor who is even allowed to open their own practice? And even then, what hoops does he still have to jump through to keep his or her licenses? So much of the system is designed as profit over people. I say that the WEF needs to be totally dismantled and moved to their own little island. These globalists want everything that any one of us has ever known in the past, and that includes a real doctor/nurse, etc. Make no mistake, this totalitarian regime that continues to be built with none of the ordinary person's consent is continuing to be built. And the cherry on top of all this is the powers that should not be want us all to die, and they mince no words about that is indeed the goal.
At Dmite Signs 72 wrote,
Hi, Dr. Sunil. I have a question. Why are doctors treating patients all the same when we are all different? This is most frustrating, and they don't look at other options for patients. Only what the insurance companies tell them they can do. Even if the patient says they would like to go a different route, they are shut down. You can't even have a discussion with your doctor. There has to be a way to get out of this system. I myself don't have insurance because they have tripled in premiums. At 61, I would like to have insurance. Little things come up as I age.
At Marinod 6732 wrote,
Here's the truth. You need to be a licensed medical doctor to prescribe treatments or procedures everywhere in the USA. So why do insurance administrative or any non-office staff have any legal right to approve or deny the doctor's professional assessment of necessary prescribed treatments or tests? Think about it. Insurance staff, hospital administrators, billing coders, government agencies, Medicare, CDC, FDA, and IH staff. All of these people are in effect practicing medicine without a license if they do not have a degree and state license.
At Jackie'sable 4372 wrote,
I am an inpatient psychiatric nurse, and I can vouch for the fact that the entire medical system is absolutely corrupt to its core. They don't give one iota about any of their patients nor the staff. They continue to slash and cut resources and give us higher workload, more acute patients, increase the patient to nurse ratio, fire staff, and they don't care at all. Profits over people.
At Joe Smith JD5ZG wrote,
There should be no U.S. government shutdown. Obama said his bill was the Affordable Care Act. That means nobody should have to get government supplements to afford health care. WTH? If ACA was real, there would be no subsidies for it, ever, in the first place. FIXIT, meaning affordable. If Billy pays $1,000 for a Honda Civic, and I pay another $100,000 so he can have it, that's not an affordable Honda Civic. FIX Healthcare. The bigger point is that healthcare is overpriced in the United States, and the mass is just accepted. Fix the cost of healthcare. Realistically, no one should need health insurance. They should just be able to pay for services rendered. Insurance companies are probably the biggest problem with the whole mess. There are other countries around the world where they pay less than half of what we pay, yet get better health results. The US system is an overburdened sham that will collapse on itself.
At Carolyn Fopp 5766 wrote,
I couldn't believe my eyes the other night when I looked at a television ad with Eli Lilly Company, Big Pharma, wrote under their name, a medicine company. Guess they just don't like the words, Big Pharma.
At Diana Pearson 1771 wrote,
I'm 76 years old and didn't realize I had kidney disease stage 3B until 2 years ago. I have a primary doctor, but he hadn't actually told me. I checked into our ER with back pain. The physician came back in my room and, angrily, asked me why I didn't tell him I had kidney disease. I told him because I didn't know. I asked my doctor about it when I saw him shortly afterwards, and he told me, yes, I was in 3B stage. I'm a little better, but I know I won't be much better because it's too late. I started eating better, drinking more water, trying to take better care of myself. I still work. I work in the same hospital with the area visited, in a transport capacity.
At Monica Gonzalez 2658 wrote,
It was a day where doctors cared and received appropriate financial payment for services rendered. Now it seems it's all about financial gain and greed over care. Please let me know I'm wrong.
At Zenit B Beats 7209 wrote,
Vivero Health. Dr. Sean Baker. It's different. Look it up. He's a famous carnivore. He's pushing 60 and holds the world's record in indoor rowing in ALLH categories. And he's a working orthopedic surgeon here in the Pacific NW. In America, instead of a carbon tax, we should have a carb tax. Heavy weightlifting with intense cardio in between will save your life and keep you young. Never eat out of cans, boxes, or packages unless it's powdered pure minerals or beef gelatin.
At Planet Mechanic 6299 wrote,
It's been broken for decades. It's designed to be broken since the beginning. Kinda scary paperwork. And these clowns get paid regardless of consequences. And the 88 vaccines required for children to go to schools that make them all stupider. They're trying to kill us all.
At Anita Cronin wrote,
I agree with everything you say. We need to do all we can to stay healthy. I thank YouTube for allowing DRS like YII and others to speak about these things. Thank you for posting. I love listening and getting more knowledge.
At Donna Boring wrote,
This is so true. My doctor switched to a different office, and my doctor 40 miles away had no more of idea of where he went than I did. These two doctors are supposed to be a team in my thyroid care. This my chart is supposed to keep everyone on the same page. I am so disappointed, but not an ungrateful person. Just totally frustrated trying to keep a prescription going.
At Zenit B Beats 7209 wrote,
I can't keep a doctor for even a year anymore. They keep leaving, retiring early, or moving. One option retired before I ever saw him, and I always have a yearly exam. This year, I'm late for my yearly exam because the most recent one quit.
At Jeffing Bonner 9551 wrote,
My. Huddled within breathing distance and not a mask on a single face. That's so dangerous and reckless, especially going into cold and flu season. And then you serve as a vector to every unsuspecting patient victim you interact with. Slash sarcasm.